Okay, welcome everybody. So today, let's start on visual, we'll start on ER. Hi, so I'm Lori Noyes. I'm the Director of Acute Care at the Lloydminster Hospital.
Okay, so Lori, can you tell me a little bit about the visual process here at Lloydminster Hospital?
Okay, so this has been a process in the making. We started out, we originally just had this board and it was just for the nursing units, and we had the nursing unit managers would come and meet every day and we would go through the board. So, you know, it's like a PDSA cycle. We've changed it until we've now come to this. We realized that it was really important that we had all of the facility management at the board because we can't just work in silos. We have to have some interdisciplinary, communication, so that and some collaboration with the other units. So from that, that's how we developed the board. On this wall, buried in here, we have all of our quality, delivery, cost, safety, and engagement. All of that is into the Viz wall itself. So as we go through, you know, quite often it's just we say green, green, green all the way down because we're all familiar with it. When we do have something red, it's a quick discussion about corrective action. Surgery.
Okay, so green for days, but red for nights. We had one sick last night. Overtime, that's 11.78. Workload right now is good. OHS, none. CSRs, none. Equipment is green as well. Beds, we have 13 out of 12.
So you're over capacity?
We are over census.
Okay.
1 so far, 1 to 2 for discharges, and the last one is red at 4 out of 13.
Since we've introduced all of the other facility managers to the wall, it's made a big difference. We see each other as a group. We all work together. We all work towards the same common goal of patient-centered care. And I think the biggest thing that I've seen is we really did work in those silos. There wasn't much communication. Now we communicate on a daily basis. An issue that is anywhere in the hospital can affect all departments. So just because CT or imaging doesn't fall under my portfolio, you could see today there was a problem with the CT scanner. That does affect my department. It affects everybody's department actually. So, you know, these are things that are now brought to the wall. They're communicated. Nobody walks away and says, I didn't know that.
Hi, my name is Garcia Ennis. I am the nurse manager of the surgery unit at Lloydminster Hospital. The daily wall walk, how it impacts me is just, number one, you get to find out what's going on in the building. So that's just basically your first overview to find out what's happening on the units and in the whole entire hospital.
My name is Garrett Neal. I am the Nutrition Services Manager here at Lloydminster Hospital. It used to be if I had an issue or a concern that involved any department within the hospital, and certainly things that spanned several departments, it was really tough to track down the people I needed to get a hold of. From being in dietary, we often deal with things that involve all the nursing wards. And when I have an issue like that, prior to doing this walk, it was very difficult to get all the nurse managers together, explain the issue, and try to come up with something collectively. Now that we're all meeting here every day, I have an opportunity, same time, every day. I know all the managers are going to be here. If I have a concern, I can voice that, and the group is very good to help me work it out and come up with a solution as soon as possible.
My name is Marilyn Younghans, and I'm the pharmacy manager in the Lloyd Hospital. The information we collect at our Viswall in the morning, we bring down to the main manager huddle, and then any challenges that are presented there, I also bring back up after this meeting. So I know that if medical is very short-staffed, we're going to do everything we can to help them that day, just to try and make the facility as a whole run smoother.
The maintenance department.
Yeah, good.
Green.
Green, no overtime. Workload is good. No OHS.
Okay, and hot water.
Hot water tonight will be shutting off about 11 o'clock.
Okay.
For probably 2 hours.
2 hours, so memos going out, everyone will know. So
we'll send something. I'll send
so
something.
it's at 2,300
roughly. It's just the hot water. We'll still have cold water at the sinks.
Okay, therapies.
No sick. Workload's good. No COSRs. No OH&S. We still have the cordless VoIP phone sheet for equipment. Our outpatient wait list is 101. Average wait time for a priority appointment is 18 days.
Wow.
It's just because of Christmas holidays and staff away. Non-priority is 151 days. And the number of inpatients being seen is 22 by physio and 22 by OT.
So look at that, in October 370 and now it's 101. That's amazing.
I'm Ken Baczynski. I'm the ED manager at the Lloydminster Hospital. Well, the daily wall walk has kept me and my department focused on patient-centered care. It has enhanced communication between myself and my staff members and vice versa. And we focus on patient care issues, the top priorities. We also focus on quality improvements. Therefore, this gives the staff an accomplishment and a sense that they can bring issues to us and we can resolve them as a team. And as a manager during the daily visual walk, it has made my job a lot easier by addressing concerns immediately, and so they don't have to pile up, and we get to the root cause and get on with it.
So after we're done the whole wall and we've gone through all of the different departments, we try to spend a couple minutes to say, is there anybody that needs to be recognized? It's important for our engagement to recognize. I can tell you there's never a time that someone's not recognized. Another thing that we'll do is, if there's been a big kudos, for example, today, and I never took it to the wall, but I should have, we just got our patient satisfaction report back, and it was amazing. I think the number that sticks out to me is 100% of patients on the medical unit and surgical unit and ER said they were treated with dignity and respect. So to me, because we try to be very patient-centered, the wall is very patient-centered, all of the departments are very patient-centered. Every day we talk patient-centered care. So that is something that is a kudos, and we bring it up. So then the other one is a quick rocks in their socks. What is a big burning issue that we need to talk about right now that needs to be discussed? Sometimes we have to have sidebar conversations, take it somewhere else, or otherwise it's done at the wall. Dietary.
I've got no sick, no overtime, good on workload, no OH&S, no COSR, good on equipment, no dietary errors or trainers.
Oh, I think we should start.
I'm sharing that stuff.
Oh yeah, I can. Materials management.
Same, all green for us too.
Really? Good.
Yeah.
Lots of gold stars today. Okay, great. So I guess today we'll just kind of do it in recognition this week. Anyone they want to recognize?
I'd say medical for having 3 days last week for no overtime.
Okay. So medical department, kudos to, I guess, management and everyone else there, right?
Yes,
yeah.
So what advice would you have for managers who are just getting started or want to improve their visual management?
There's no right way or wrong way to set up your visual walls, but my advice is to have the information relevant, don't clutter the board, and have the information up there that you can track and is measurable.
You have to make sure that you keep your board fluid and change it as needs arise. Don't be afraid to change what you're tracking whenever you need to.
I would say make sure that your wall is for your unit. Every unit has different things that they want to emphasize, they want to track. So make it be personal to your unit so that it's the most effective.
You don't have to make something perfect. We say all the time in Lane, just start with something. And from there you can make improvements as you go.
Plus we learn from one another, so if you walk around the building you can see the visual walls, and something that I haven't thought about is on another wall, so I can implement or discuss with the other manager if there's some issues, how can I overcome in my own department.
I think a lot of us had our doubts as to how effective this was going to be when we first started out. Now that we're all participating, I think we've all gained something from it, and I think we've also all contributed something to it. I think it's a fantastic idea, and we're doing great work to improve things for our staff, and most importantly, our patients.
Okay. Sounds good. Okay.